Hello, I'm Reis. I'm a family doctor from Regina. So when I reflect back on my CQIP project and learning time, I think that the most important progress that I made is a little bit of a shift in how I look at and approach a problem. So these are a few bullet points from our very first online module on the first page, and I just thought it was interesting that the first thing I ever read in this project is something that actually had the biggest impact on me. So the first point says, having a clear understanding of the problem is a huge step towards successful improvement project. And the second says, truly understanding why the problem exists is the key to identifying the change ideas that will likely have an impact. So before I participated in the project, I think that I had a little bit of a problem approaching a problem with a solution in mind. So because of this, I would tend to spend my time and my resources focused on the implementation of my solution, and I might miss some background work to actually identify why my problem exists. In my very first meeting with Dr. Capriva, who was my coach, he outlined for me how I was making this jump, and I just didn't see it, I guess. I didn't mean to not listen, but I couldn't understand that at the time. But through working in my project and progressing through it, I could see that he had a point, and I learned sort of how to step back and look at a problem from the whole. So here I've shared, this is my very first fishbone diagram. And that's probably about the third copy of my driver diagram. The first one wouldn't fit on here. But I just thought it was really interesting to look back and see, because as a clinician, you would never walk into a room and tell a patient that you know what's wrong and sort of start from the top. But I think that in my approach to problems in a system, I was starting up here, and I didn't understand why I was not having success. So even though this is like the basis of QI, I think it was the biggest learning point for me. In terms on reflections and challenges with the experience, for me, the biggest challenge, I think, was learning how to work in a complex system. So once I identified my project, I felt like I had, some ideas and this passion to move forward and drive this project. But unfortunately, you can't just take your project and put it in a room and focus only on that. So I really learned that you have to engage in the system that you work in and try to untangle, I guess, all of the co-problems that exist with your initial problem. So some things that I had a little bit of problems with initially were a bit of buy-in and engagement, competing projects and interests, as there's always a lot of work going on in clinical settings, data and measurement issues, and also just accepting the side effects of change. In terms of future development, one thing that I found really interesting just for personal learning was the psychology of change. So as a few people have pointed out when they've come up here to speak, everybody came with 22 projects that made sense. Like when they presented them, we were all like, yeah, that sounds like a good idea, why don't we do it? But it still was so hard to try to implement these changes. And I've sort of been reflecting, I guess, on why sometimes I might be resistant to change or why other people might be resistant to change, and it's just something I'm interested to learn more about. In terms of planned quality improvement work, my project is underway. It's not quite complete, so I'll continue with that. At the Family Medicine Unit, we do have a quality improvement team, and we've identified some ongoing projects from the work in my project in CQIP. And probably most exciting, I'm going to start developing a curriculum for the family med residents in Regina that's solely based on quality improvement. So I think it's exciting we had a few residents in the project, but it's exciting for that to be part of the mandatory curriculum moving forward.